this pandemic, the coronavirus, as it was referred to at the time, was on our radar screen for many, many weeks before, in fact, it became a framework of reference for the nation. We had the opportunity as well to develop further relationships, not only with the federal government in partnership with the CDC, but also HHS and other federal agencies, particularly FEMA, when it came time to repatriate that cruise ship. You may recall a number of months back, we had a cruise ship off the coast of California, thousands of passengers and crew that we ultimately became responsible for in terms of bringing them back onshore and then bringing them back all across the rest of the country, and for those many, not only passengers, but primarily staff, getting them back home overseas. Those relationships furthered our resolve, our recognition of the imperative to meet this virus head-on. Also began the process and protocols and procedures for addressing the need to hospitalize individuals, to test individuals, to provide alternative care sites outside of the hospital system for individuals, and began the process of rationalizing our approach. We formally moved forward as we started to see the spread in Washington State, skilled nursing facilities, and we saw and experienced our first community spread here in the state of California outside those repatriation missions. We moved forward as the first state in the country with a stay-at-home order on March 19th. And that began the process of really developing strategies and partnerships with local health officials, county elected officials, all up and down the state of California. Remember, California's 58 counties, over 470, almost 480 cities. And when we talk about our state, we talk about scale and size and scope that is equivalent to 21 states' populations combined. So it's trying to reconcile our challenge, but also trying to reconcile the differentiation in regions, large and small, all across the state, became a big frame of focus and engagement at the local level. As a consequence of that, we started to socialize the term localism is determinative, meaning local conditions are such that local electeds, local health directors have a unique understanding of the criteria of concern, also the criteria to which they would afford a remedy to those concerns as it relates to the spread and the transmission of this virus. We started to see density of transmission in certain parts of the state. Other parts of the state just didn't experience any real transmission. We saw deaths increasing in certain parts of the state. We did not see that in other parts of the state. Many counties, many regions asserted themselves, understandably, making that point that they're different from other parts of the state. And we began the process of what we referred to as attestations. And these were locally directed attestations, attesting to certain criteria, certain responsibilities, certain procedures and plans that would be put into place through a technical engagement with the state of California that would allow certain parts of the state to open a little bit more quickly than other parts of the state if, in partnership with the state of California, they attested to being prepared and being accountable and responsible for the transmission of this disease. You recall at the time we talked about making sure that part of that attestation includes making sure you have adequate testing, making sure you have adequate capacity to begin the process of contact tracing, making sure you have appropriate levels of PPE, personal protective equipment, not just face masks, but gowns and gloves and the like. We also had responsibility within the hospital system to make sure that they could address possible need for a surge, and that include not just hospital space, but also prospects that they have enough ventilators and ICU capacity as well. We also had a framework of focus on homelessness, on issues related to seniors in our skilled nursing facilities and our residential care facilities, as well as people in congregate facilities, locked facilities, county jails, adult correction facilities, and the like. Butte County was the first county to move forward with an attestation, and we started our phased approach to reopen the economy here in the state of California. We talked in terms of 4 phases. We have been clear through the attestation process that we will allow counties to move forward on their own time through 3 phases, not the 4th phase. And I'll remind you that 4th phase is large-scale festivals, outdoor facilities and concerts, rather, facilities like convention facilities and the like, large events, for example, sporting events. That's all in that 4th phase, and no part of the state of California is allowed, even through that attestation process, to move in to that 4th phase. But people are pacing in and through phase 2 and phase 3. We had, at last count, last week, we had over 52, and then we went to 54 counties that have gone through this attestation. We highlighted one county that was interested in moving forward to the attestation phase, Imperial County, but was simply unable to attest that the conditions were such that they can mitigate the spread of the virus and also protect their citizens if indeed there was a surge.